Hey, it's me. I just left my chiropractor's office, and honey, I got a testimony for you. 2 years ago, I was in so much pain. My functional leg length, which is when structurally your legs are the same length, but for some reason your legs appear to be not the same length. So I would put on a pair of pants and one pants leg would be significantly longer than the other. I knew I wasn't born like that and that my legs were actually the same length, but something was going on. I was so unstable. Like I would walk and just like fall over while walking and look like I was drunk, but I hadn't been drinking or anything. Just very unstable. I had to make sure I bought stability shoes just to give me a stable foundation. My pelvis just felt like, one side had moved forward and one side had moved backwards. And then the back pain started. And at first it was a dull ache. Like if I was sitting too long, I would feel like I had to stand up slowly and just wait a few seconds for it to get to the point where I could move. Then I was trying to help myself by stretching more, and I think I just stretched the wrong way using an exercise ball, and I felt a sharp pain, and that pain stayed with me for a while. Like I was in so much pain. Like I would get in bed at night, like every movement hurt. I would get in bed at night. I couldn't turn over because it hurt. Riding in a car, driving in a car, it hurt. It hurt getting into the car because I had to bend in order to get into the car. It was excruciating pain all the time. I had a really good MD at that time. She has since moved so far away that I have a different doctor now. Yeah. But this one, she had been my doctor for like 10 years. Really excellent doctor, would listen to you and find out what was going on. And I was in the office. I was just crying because I was in so much pain. And I was like, I don't know what to do. I just know I can't live like this. Like I don't know what's going to happen because I can't deal with this. So she's going to prescribe oral painkillers. And I told her, I said, a lot of these I can't take because they break me out in hives. My body just does not like them. So she prescribed something. It was called Voltaren, is the name of it. It's like an anti-inflammatory gel. And I was concerned about that. She said, no, it's not systemic. It doesn't go through your whole system. So you should be fine with this. And so that took the edge off the pain so that I could function and not get hooked on narcotics. After my MD prescribed this Voltaren gel, she recommended that I go to a spine specialist. I went to the spine specialist and he was barely even paying attention to me. I was so annoyed with him. I ended up going to him. Did I go to either 2 or 3 times? The last time he was on the phone most of the time. I think we were done with each other at that point. Basically, he did x-rays, he did an MRI, and he said, oh, I see, you have a bulging disc, and that's what's causing the pain. And I said, nah, okay, all right, I see that little bulge, I do see it, but I don't think that's where the pain is coming from. My hips feel like they're rotated, like something's going on with my pelvis. I don't know what it is. Oh, no, your pelvis can't rotate. Like it would have to take like a car accident, or you would have to have a really hard fall. I said, well, I had a hard fall. I fell down the stairs years ago and I've had problems since then. Would that be it? Oh, I doubt it. You would have known long before now. It's this bulging disc. We're going to give you a cortisone shot in your spine. And if that doesn't work, then, we can do a surgical procedure. Okay, you moving kind of fast. I have just told you what's going on in my body. You're telling me it isn't possible without even checking on that. You fixated on this. Oh, it's a bulging disc. No, you would just like a paycheck. That's what this is about. So I told him there will be no shots in my spine. Just like that. And at that point, he checked out. He didn't care if I wasn't going to follow his course of treatment, even though he hadn't thoroughly checked me out, then he was done with me. So I was done with him. I was still in pain. It was just not as acute. The yoga studio that I had been going to before this excruciating pain, I had to stop doing yoga. I stopped working out. There was an acupuncturist there, and she was trying to build up her clientele. So she ran a special. So I went to this acupuncturist and I told her, I said, I'm in pain all the time, like all the time. If I don't use this gel, this anti-inflammatory gel, I wouldn't be able to function. And she said, okay, she said, have you had acupuncture before? I said, no. Like, I didn't know how it worked. I had never even really thought about having it for myself. I do not like needles at all. And, yet I was there because I needed help. And she said, okay, I really don't like to do this on people who've never had acupuncture before, but I'm going to put 2 needles in your hand, which already doesn't sound like fun. And, then I'm going to ask you to walk with me. I'm going to turn the needles. And when you feel relief, let me know. And I was like, okay. So she put the needles in my hand. I mean, little ouch going in, but nothing major. The acupuncture needles are they're tiny. They're like skinnier than a hairpin. So she did that and said, okay, stand up, walk with me. And she walked slowly and she turned them as I walked. Turn. At a certain point, the pain was gone, completely gone. And I looked at her and I said, oh, the pain is gone. It went away. And she said, okay. And then she left them in there for a while and then took them out. And when I left, I still felt better. I was pain-free for several hours, but then it started to return gradually. So I started going to her twice a week. And I went to her twice a week for a while, and the pain would go, but it would come back. And also she was treating me. She was putting the needles in my back and my leg. It would go away and come back. So I knew there was something to it. I didn't know how it worked. She laughed at me because I would always look at her like she had just done some magic. And she's like, it's medicine. It's Chinese medicine. And they've been doing it for a very long time. So I know it's new to the Western world. It seems very strange, but it's commonplace in Chinese medicine. She did some other techniques. When she did cupping, and I know there are people here who poo-poo cupping, it's not anything. What kind of science? Not which science. I don't know what the term is, but, look. She did cupping on me the first time, which is putting fire in a glass cup, like she had a flame, all right? And I was like, don't burn me. A flaming piece of cotton at the end of some tongs, put it into a little glass cup or dome, to suck out all the air and then put it on my back real fast. And so it's warm on my back. But because she's created a vacuum by forcing all of the air out of the cup, it pulls my skin up into the cup. Now she's doing it on my back, so obviously I can't see all of that happening, but that's what happens. After she did cupping on me, that took away the vast majority of the inflammation. I was able to stop using the pain relieving gel. And then I realized I need a chiropractor. So I went to my chiropractor that I had gone to before when I first fell years ago. I mean, it's been so long. It's been like, when did I fall? Like 15 years ago or something like that. I fell down the stairs. And he did what he could. Like, he really, really, really helped me to progress. It was like the acupuncturist did her part. Now it was time for me to find somebody else who could help me on the next leg of this journey to healing. So he treated me. He would use TENS machine. He would use an infrared machine to help with pain and inflammation. Sometimes he had me on this vibrating thing. One time I came in and I was like, I felt like I was, I don't know, like I was stuck. Like if I moved a certain way, it was going to hurt. So I was stuck in a certain position. And he had me do this thing, which I thought was going to hurt me more. Like he was like, okay, hold this weight and go back and forth as fast as you can. I was like, dude, did you hear me say I can't move? He was like, trust me on this. All right. I trusted him. He's been doing it a long time. He got me out of pain initially when I first fell. And I know he knows what he's doing. Dr. Jones. So I did this thing and it hurt in the beginning and then it didn't hurt anymore. I was like, oh, okay. And he was like, you know what? If you give your body what it needs to heal, your body wants to move. We're made to move. And if you're sitting all the time or you're eating crap or you're letting like negative emotions have their way with you, your body holds on to a lot of stuff that it doesn't need. So if you give it what it needs, it will heal itself. Okay. All right. So movement. I started working out with a trainer. Oh, hi, Tolly. And that has helped to strengthen my body. She really works on strengthening the core. That chiropractor had to close up shop. And I went to aerial yoga, just trying something new. I found that it was great for my back because I would hang upside down. It would decompress my spine. So I would feel so much better after that. And I mentioned to one of the instructors that I was having some issues with my back and I was looking for a new chiropractor. She said, oh, you should go to my guy. I went to him. I explained what was going on. He did an x-ray and he said, oh, I see what's going on. Your spine is like leaning this way and your pelvis is rotated to compensate. When one thing changes in the body, it triggers, the knee bone connected to the leg bone and all that other stuff. So your pelvis is rotated because it can rotate, contrary to what that friggin' surgeon told me. That still pisses me off. I'm thinking about sending him a letter. Yes, the pelvis can rotate. And that's what was happening. And I was just so out of whack at that point that it was just going to continue to get worse. That's why it seemed like one leg was longer than the other. All of this stuff is connected. In the beginning, I was going to this chiropractor twice a week. And I spent a lot of money on healthcare. Like, I would go, where's my money go? Oh, okay, that's where it's going. It was healthcare and personal trainer. And a personal trainer seems like a luxury, but it was keeping me together. So October 2015 is when I first started going to this chiropractor. I was going twice a week. After a certain number of visits, he said, well, x-ray again. I think it might have been 30 or 35, something like that. X-ray again. And it was better. And I realized I feel better, He would adjust me, also known as, cracking your back, cracking your neck. I would feel instant relief. The instances of discomfort became further and further apart. So my last visit here, he took x-rays and I got to see them today. Like if this is center point, the way your spine is supposed to be like this, mine was like that. Now it's like this. It's gone from 10% to 4%. He said, you're within the normal range right now. And I said, yeah, I feel so much better. I rarely have pain. Sometimes I have stiffness. I can tell that my pelvis is still a little bit off center, but it's nothing like it was. He said, okay, now I want to see you once every 3 weeks, basically for maintenance. He said, you're doing other things. You're working out. You're making sure you stay active. It's helping a lot. That's making my job easier. And I just told him, thank you so much for working with me, like continuing to work with me. And he just kept thanking me for doing the work. He's like, a lot of times I see patients, they'll come in for a couple of adjustments and then stop. He said, but you have really been on it. And I'm like, yeah, because I cannot go back to where I was before. I can't. I feel so blessed, so fortunate that I have health insurance. I'm so thankful that the people who have worked to get me back to normal have been placed into my life, like, you never know. Like I did some work too, but a lot of people look for healthcare providers, look for this, look for that, and they don't find who they need. But I was able to find exactly who I needed, and I just feel so fortunate. And am I 100% yet? No, I'm not 100%, but I'm working on it, and I'm so much better. And most days I'm pretty darn good. And I'm smiling. And I wasn't smiling 2 years ago. I was just in pain. So I wanted to share that with you. That's not only my story, but if you are having back, hip problems, maybe even some other health problems, do some research. Don't let somebody tell you what you don't feel, what can't be happening in your body. Don't let anybody tell you that. Let anybody tell you you have to have this procedure, you have to take this medication. Do your own research and you decide what you want to do. You decide. It's your body. You know how you feel. Be honest about it. Don't, be lying to get drugs or whatever. Don't be afraid of these doctors. Yes, they went to school. Yes, they have all these degrees, but you live inside your skin. So you let them know how you feel. If they don't listen, you find somebody else to talk to. And I'm not talking about getting a bunch of yes men or yes women. Oh, you want this? Oh, you think that's a good idea? Here, yeah, let's try it. No, I'm not talking about that. You want somebody who has some expertise and knows what they're doing, but who will say, oh, okay, you're saying you feel this way, and because you've done some research on your own, this medication affects you this way. You've tried this in the past and that didn't work. Let's work together on this. That's really what it should be. It should be a collaborative effort, not somebody telling you this is what's right for your body. And I know this is the only thing that'll work for you because I have a degree. A lot of us treat the doctor like the doctor knows everything. No. Keeping in line with my personal theme of self-care for 2017 and beyond. I'm just creating a habit of self-care for 2017 and encouraging other people to do the same. I hope this has helped someone. Get in the driver's seat of your own healthcare. If you got a problem, you put together a team of people. If you don't have insurance, I don't really know what to tell you to do, honestly. I wish I did. I didn't have insurance for 3 or 4 years. I was working production and beginning my acting career. If I got really sick, I would go to the nice free clinic, because some of these free clinics, one time I remember I went into one and I was just like, nah, I ain't that sick. Come out of there with friggin' Ebola or something. But I went to the one nice free clinic, waited all day long to be seen. I mean, I had access to healthcare and I did not have to pay for it with anything other than my time. So I don't know. That's why it's so important. I know people are against the Affordable Care Act or Obamacare, but had I not had access to healthcare, I hate to even think of how this could have turned out, All right. I'm going to end this video on a high note. I feel so much better. I continue to get better, and I'm committed to health and wellness in my own life, and hopefully this has inspired somebody else to do the same. All right, I will see you soon. Bye.